Hello everyone, welcome back to Nursing Simplified. In today's lecture, we are going to discuss peritonsillar abscess, which is also known as Quinsy. It is one of the common complications of acute tonsillitis and is frequently encountered in ENT practice. As nurses, understanding this condition is important because delayed treatment can lead to airway obstruction and other serious complications. In this lecture, we will discuss the definition, causes, risk factors, pathophysiology, clinical manifestations, diagnosis, management, nursing care, complications, prevention, and patient education. Definition: peritonsillar abscess is collection of pus between the tonsillar capsule and the muscles of the pharynx. We call it as peritonsillar space. So it is called peritonsillar abscess. It usually develops as a complication of tonsillitis, most commonly acute bacterial tonsillitis. The infection spreads beyond the tonsils and forms an abscess in the surrounding tissues on one side. So we can either it can be unilateral or sometimes bilateral. It is most commonly affects adolescents and young adults but can occur at any age and causes severe throat pain, and sometimes it may affect breathing, and most of the times it can affect the swallowing. Anatomy involved: the space between the tonsil capsule and the pharyngeal muscles is called peritonsillar space, and the pus is formed and collected in this peritonsillar space, and it is located near the palatine tonsils, which are formed with a loose connective tissue, and it is close to the airway structures. That is the reason the infection can easily spread. Etiology: the most common cause is untreated or partially treated bacterial tonsillitis. If untreated, or in case of severe tonsillitis, it can lead to peritonsillar abscess. The bacterial infections like streptococcus and staphylococcus infections can lead to abscess formation. Poor oral hygiene, low immunity, smoking, and chronic throat irritation can lead to the condition peritonsillar abscess. And anaerobic bacteria and Haemophilus influenza can also cause infection to the tonsils, which can eventually lead to peritonsillar abscess. There are several risk factors which increase the risk of developing a peritonsillar abscess. They are probably they can be recurrent tonsillitis, chronic tonsillitis, in immunocompromised conditions, diabetes mellitus, delayed treatment of the throat infections. So, these factors allow infection to persist and to spread and to form the pus, which is termed as peritonsillar abscess. Pathophysiology. Let's understand this disease process step by step. First, the infection is spread. Infection causes the acute tonsillitis, and this infection spreads to the peritonsillar space, that is, the space mm, beyond the tonsillar capsule surrounding the tissues, and causing inflammation, edema, and swelling of the tissues. So, by formation of the pus, which can be lead to the symptoms like pain, difficulty swallowing, airway obstruction, and there the where the pus is collected, the bacteria multiply and accumulates in that pus. So this is the reason where it can cause pain and difficulty in swallowing. This is the diagram of peritonsillar abscess, and see these are tonsils. This is the abscess or the pus formation which is located in the peritonsillar space. So we call it as peritonsillar abscess. Clinical manifestations. The patient may present with severe unilateral throat pain if the abscess is on one side, and fever. As we know, if there is infection, most probably the patient will suffer with fever. Malaise, that is nothing but weakness. Dysphagia, difficulty in swallowing. Hot potato voice, so we call it as muffled voice. Difficulty in opening the mouth, so we call it as trismus. Swelling and deviation of uvula, and also odonophagia, which is painful swallowing. Dysphagia, it is difficulty swallowing. Odonophagia is painful swallowing, and sometimes the drooling of the saliva. Ear pain can due to this tonsillitis. So if it occurs on one side, if it is unilateral, the side on which it's affected, the ear will be paining on that side. Swelling around the tonsils and bad breath. So these are the symptoms that commonly occur, and they are often severe and progressive. Diagnostic evaluation. Diagnosis is mainly clinical because it is a abscess formation. The healthcare provider may perform physical examination of the throat. So, physical examination through inspection, they can identify the enlarged tonsils and uvular deviation, and they can see the presence of pus and inflammation or swelling through physical examination or inspection of these tonsils. Blood test or blood analysis can be done where complete blood count can be calculated in that. So WBC count will be increased mostly in most of the cases. If there is infection, the WBC, the white blood cell count will be increased in the blood. Throat culture can, or the throat swab can be taken if there is any suspect for infection. The swab is taken and it is cultured to know the presence of infection, the type of bacteria. And needle aspiration of pus can also be done to identify if there is any or microorganism present in that pus. And sometimes ultrasound or CT scan can also be done if the diagnosis is not certain through the following diagnosis when made in the condition. So ultrasonography or CT scan can be done. Early diagnosis helps prevent the complications. So early diagnosis is really very important. Medical management. The goals of treatment are to control infection, relieve symptoms, and prevent complications. The medical management then include so antibiotics are given in case of any bacterial infection. Examples can be amoxicillin, penicillin, clindamycin, ceftriaxone. Analgesics are the drugs that can be used to reduce pain. Examples paracetamol, ibuprofen, diclofenac. Antipyretics are the drugs that are used to reduce the body temperature to normal. Examples paracetamol, ibuprofen. Corticosteroids are the drugs that can be used to in case of severe inflammation to reduce inflammation. Examples dexamethasone and prednisolone. And these steroids help reduce the throat swelling and improve swallowing. And nurses should monitor the effectiveness and adverse effects of these medications. And the medical management also includes maintaining adequate hydration, rest, monitoring airway patency, and pain control by giving analgesics, and treatment of the fever by giving antipyretics and antibiotic therapy for treating infections. And most patients improve rapidly when treatment is started early. Surgical management. When a large abscess has formed, surgery may be necessary. Common procedures include incision and drainage of abscess, where small incision is made to drain the pus, and needle aspiration. Here, the pus is removed by using a needle. The pus collection, where it is collected, the pus is removed. Tonsillectomy, in case of recurrent tonsillitis, recurrent infections, then removal of tonsils can be done. Ectomy means removal. Removal of tonsils is called tonsillectomy. In recurrent cases or severe infections, this surgical management or intervention can be done. And all these things are done in case of severe cases and case of recurrent infections, and it helps relieve the pressure and infection. After drainage, the patients usually experience immediate symptom relief. So, incision and drainage. A small incision is made in the abscess and pus is drained out. It is done under local anesthesia, and after drainage, it reduces the pain and swelling, improves swallowing and breathing. Nursing management. Nurses play a crucial role in patient recovery. Key nursing responsibilities include assess the airway and breathing, monitor swallowing ability, assess pain level, administer the medications as prescribed, and assess the vital signs, encourage fluid intake, adequate fluid has to be taken, and provide education about maintaining oral hygiene, and provide patient comfort, and observe for any bleeding after drainage procedures or after any surgical procedures done, and educate the patient regarding treatment compliance. Airway assessment is always the highest priority. Complications. If this peritonsillar abscess left untreated, serious complications may occur like airway obstruction, spread of infection to deep neck tissues, and sepsis or infection, dehydration, and recurrence of the abscesses, and aspiration pneumonia, retropharyngeal abscess, mediastinitis. It is rare. Mediastinitis is rare, but of course, if it occurs, it is a serious condition. Therefore, early treatment is extremely important. Prevention and patient education. So, teach the patient regarding using the full course of antibiotics, maintain good oral hygiene, and treating the infections or tonsillitis early, using complete course of antibiotics, avoid smoking or irritants, and seek the medical care in case of severe throat pain. Drink plenty of fluids, avoid smoking, alcohol consumption, and follow up regularly with healthcare providers. Report breathing difficulties if present immediately, and proper education regarding this reduces the recurrence. To summarize, peritonsillar abscess is a collection of pus around the tonsil, usually resulting from bacterial tonsillitis. Patient commonly present with severe throat pain, fever, difficulty swallowing, and a muffled voice. So, early diagnosis and treatment are essential for a successful outcome. Thank you for watching. If you found this video or helpful, please like, share, and subscribe to Nursing Simplified for more medical surgical nursing lectures. Happy learning and stay healthy.